At the University of Kent in England, some studies have been done to show that B12, plain old B12, remember maybe your mom or dad used to go to the doctor to get B12 shots. That was cyanocobalamin. It was a type of B12 that was used to improve B12 levels in the blood. Now we use something called methylcobalamin. At this University of Kent study, they just studied all kinds of B12, anything with a cobalamin on the end. They studied that and they looked at how it worked inside the cell to create benefits in the way that the red blood cells were created and the way that the nervous system was benefited. It improves the way that your mind works. It improves the way that your nerves work. It conducts signals better, the nerve does, when it has adequate B12. Well, the things that keep the B12 from creating that benefit is that your body doesn't have what's called intrinsic factor in your stomach. Intrinsic factor takes the stuff that's in your food that creates B12 and lets it be absorbed. If you don't have that, like if you've had a stomach bypass, you have lots of stomach irritation, your intrinsic factor may be low. It's hard to get past that, but it's easy to get past B12 deficiency by putting some B12 into your diet. Certainly foods with B12 in it are helpful, but really for the absolute kind of the lock, you either do an injection once a week of B12. I like methylcobalamin. You do a shot once a week, or you can just put a drop under your tongue every day. A little tiny bit of folic acid with it is good. Also, there's a little tiny pellet, a little naturally sweetened pellet that you put under your tongue with B12 and folate, and that's super duper helpful. The great news from the University of Kent study is that there's a reduction in the development of cancers when there's adequate B12 on board. Lots of reasons for that. Lots of the cellular machinery, all the stuff going on in your cells, works better to create a cancer-free environment. As always, if you have any risks or concerns about cancer that you're not clear about, get with your doctor. But B12 looks like a win. So get with your doctor. We're better together.